back pain is a major health concern. Nearly half of all Americans will experience some type of back pain at some point in their lives, while 1 out of 4 people have it right now. And with so many different treatments available, how do you know which one will best address your problem? In this video, we'll explore the different types of physical therapy for lower back pain and discuss why each treatment may or may not work for you. We'll also explain the benefits and drawbacks to each therapy so that you can make an informed decision about which to try next. And if you like it and want more videos to improve your health, don't forget to smash the subscribe button. Physical therapy for lower back pain involves exercises, manual therapy, and other treatments to help resolve the pain. PT for low back pain can be divided into 3 categories: non-operative, operative, and post-operative. Non-operative physical therapy focuses on non-surgical means of treating the low back problem. This may include foot orthotics, pelvic stabilization, core stabilization, lumbar stabilization, education about the lumbar anatomy for proper body mechanics, manual therapy such as massage or taping, muscle strengthening and stretching exercises with resistance band or tube exercise machine assistance to improve core endurance and strength in abdominal muscles, as well as hip flexors and hamstring muscles that are weak in many people with chronic low back pain. PT for back pain may also include ultrasound, transcutaneous electrical nerve stimulation, TENS, interferential therapy, and electromagnetic field therapy. Biofeedback training may also be of benefit. Some people with chronic low back pain will benefit from education about their condition, as well as relaxation training such as biofeedback or cognitive behavioral training. Non-operative PT may best address acute low back problems or intervertebral disc injuries that haven't yet progressed to a more severe stage of degeneration or rupture. If a patient does have a severe disc herniation or ruptured disc, non-operative PT best addresses the pain and helps to prevent further deterioration of the disc tissue. One 200-pound person with a protruding L4, L5 disc will require about 8,000 newtons force to compress the spinal cord in that disc when approached from between 2 adjacent vertebrae. So for instance, if you had an L4, L5 herniation that was protruding at 18 millimeters from your spine and compressed from above, you'd need about 8,500 newtons to reach in through the hole that is 18 millimeters wide to compress the spinal cord at T5, T6. In a case where a person has an L5S1 herniation that is protruding at or near the level of the sciatic nerve, you'll likely have to apply a much higher amount of force to compress the spinal cord in that disc, as you're going to have to go through 2 or more vertebrae, compresses from above, in order to reach directly through the disc herniation. In either case, if using a tape measure, one should take into account the patient's height so as not to measure something like 18 millimeters if the patient is 6 feet tall. Measurements are generally given in millimeters. What causes back pain? A bulging disc is generally a benign cause of back pain that does not have as much risk for nerve irritation as, for example, a ruptured disc. A protruding disc is much more dangerous, as it has a higher risk of pinching the spinal cord or nerve root, which can lead to radiating pain and/or numbness into the extremities. The general rule of thumb is that bulging discs are less dangerous than protruding discs. But even if you have a seemingly benign disc herniation, bulge, if it presses on the spinal cord, back pain may be felt in your lower extremities, such as your calves or feet. Pain due to a disc herniation can begin almost immediately after the injury, or may start as a mild and intermittent pain that becomes progressively worse. The location of the pain depends on which nerve root is compressed and where it passes through the vertebrae. People with a disc herniation have additional risk factors that make their symptoms more severe. For example, smoking can cause additional wear on the vertebrae and aggravate existing problems. Being out of shape makes you more prone to injury because your muscles are weak and your joints are not well stabilized when you move. When should you seek professional help? A disc herniation can cause sciatica, as the most common symptom of a herniated disc is pain, numbness, or weakness in the legs. There is also back pain, muscle spasm, and even loss of bowel and bladder function. These symptoms are similar to dermatomal pain syndromes and peripheral neuropathies. The patient may also develop a foot drop, in which they lose control of their foot muscles while walking. In later stages of a herniated disc, the patient may develop an inability to walk altogether. If left untreated and with time, this can lead to permanent paralysis or even death. A doctor can detect a disc herniation through imaging tests such as an X-ray or MRI. If the herniation is protruding, it is relatively easy to see in an X-ray. But if not protruding, the exam may reveal other causes of back pain, and it may not be necessary to pursue the disc diagnosis further. It is important to note that a normal MRI will not disprove a herniated disc, but will rule out other causes of back pain, such as osteoarthritis or infection. However, the inability to diagnose a disc herniation by an imaging test does not imply that the problem can be successfully treated by conservative measures alone. It is important to see the doctor if reports of back pain are persistent, or if there is any other medical condition that may be causing major problems, such as headache. The doctor will begin by taking a thorough history of your back pain and seeking to eliminate other potential causes. The physician will also perform an appropriate physical examination, complete with neurological testing, such as muscle strength and reflexes, in order to evaluate your mobility, strength, and sensation. Sport to reinforce your back. If you are a basketball, baseball, or football player with an underlying disc herniation, it may be helpful to strengthen your back muscles by engaging in lower body exercises such as squats and deadlifts. These exercises can go a long way in preventing future injuries and boosting your performance on the field court. There are several types of rehabilitation for back pain that have been shown to be effective. The most common type is physical therapy, which is done under the supervision of a physical therapist who specializes in treating muscle and joint problems. There is also what's called manual therapy, which is done by someone trained in deep tissue manipulation techniques such as massage and manual techniques such as trigger point release or acupuncture. I hope you enjoyed this video. You're going to heal your back and that you learned something about the benefits of physical therapy. If you have any questions, feel free to leave a comment below. Also, don't forget to let us know if this worked for you and how it affected your body. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.